Talking to Dr. Faulkner from Meharry Medical College, and we're dealing with diabetes and kidney disease. One of the real issues dealing with kidney disease and diabetes, Dr. Faulkner, as you probably know, is the whole issue of weight control. Let's talk about that as an issue that you face dealing with some of your patients.
Well, of course, when you talk about prevention of diabetes, obesity is very much related to and probably the #1 cause of diabetes mellitus in the United States of America. As you know, we overeat, we supersize, and that has been a tremendous problem that we see as a big cause for diabetes. Now, as we look at diabetes occurring in childhood now, you know, it used to be what they used to call the juvenile diabetes or the insulin-dependent diabetic. Now we're finding children with the adult type of diabetes starting very early in life, and those children are extremely obese. So if we wanted to prevent diabetes, which cost about $92 billion in 2002, if we want to cut that cost, if we want to control diabetes, we can start out early with diet and exercise. And of course, you know, they had cut a lot of the exercise out in the schools, and people don't walk, and people drive everywhere, including myself. If we go back to exercise, walking, I think that we can, and stop supersizing, then I think that we can grab some type of a hold on the weight control and prevent a lot of diabetes.
Just a little prevention in terms, if you're talking about something that costs $92 billion, if you're talking about a very little prevention ought to be able to deal with that as an issue. You know.
And see, that covers all of diabetes. That's all the home health visits, the hospital visits, the amputations that you get from diabetes, because diabetes is the #1 cause for non-traumatic. That means not an accident causing an amputation, but just non-traumatic amputations. Diabetes is #1 cause. Big cost in diabetic eye disease, with diabetic retinopathy, blindness from diabetes. So we can prevent a lot of problems that we have. Heart disease, heart attacks. A lot of patients with diabetes have coronary artery disease. So we can prevent diabetes, we can curb a lot of the costs that's related to diabetic care.
And this would include medicine, hospitals, and the whole thing, just the whole medical bill that we have to pay as a nation. That we can really deal with that.
Exactly.
Well, it seems to me, well, do you believe that we are as actively engaged as a nation in trying to deal with prevention rather than simply to wait on something to happen?
I think that we are. I think that a lot of people do understand that we need to cut back. A lot of states have weight control programs, and we're working desperately trying to educate patients when they come into the clinics to see us, especially at Metropolitan Nashville General Hospital and the clinics of Meharry Medical College. We even implemented a program in family medicine at Meharry, where we implement all of the diabetic indicators in the electronic medical record to make sure that we don't miss any patient that comes in, look for those indicators that might end up in organ damage.
And so there's a real push on in reference to trying to deal with this as a disease to prevent diabetes.
To prevent diabetes and to control the diabetes if you already have it. And to look for any organ that might be exposed to trauma from diabetes.
When you talk about organs exposed to trauma from diabetes, what are we saying?
We're talking about brain. We don't want you to end up with a stroke. So we don't want you to have a high cholesterol, which could cause you to end up having a stroke, heart attack, or peripheral vascular disease, where you would end up having to have amputations, or kidney disease, which you would end up on dialysis, or eye disease for blindness. So we try to get you seen by the specialists that you need to be seen by, and to monitor your blood sugar during the primary care clinics, and monitor your organs as well.
Well, now, have we always had this interest in diabetes as a disease? I mean, have we always been that concerned about it as a nation, or as physicians, as within your profession?
Yes, we've always been concerned, but we never had this explosion of diabetics, you know, because we never had the obesity that we're seeing now. As you know, the obesity has increased over the past 20 years. 20 years ago, we didn't have all these obese people.
And that is one of the major factors, you would say, dealing with diabetes.
Yes.
That if we could really do something to control our weight, just for the sake of health, and health alone, that would impact how much we pay for these in order to deal with this disease.
Yes, yes. It would definitely help.
And so it would be cost effective in a real sense to go as far as we possibly can to eliminate it. Now, Meharry Medical College also is associated with a clinic. Is it not a diabetic clinic where you?
Yes, we do have diabetic specialists at Meharry.
Well, you also, I think at one time you talked about having a center there for people who have to go on dialysis and et cetera. Why don't you say something about that center and how it's supported?
For dialysis, so if you end up on dialysis, if you end up with end organ damage from diabetes or any other disease and you end up on dialysis, yes, we do have a chronic dialysis center at Meharry. It's a partnership with Dialysis Clinic Incorporated and Meharry Medical College, and we have a center right there on campus, and it's a very nice center.
And it's open to people in the general area?
Oh, yes.
It's open to anybody who would like to come in, or is there some kind of special kind of health insurance that they have to have in order to take advantage of the...
Yes, all patients must have some form of coverage to be in the center. The state does not pick up coverage unless you're under TennCare, okay, and the federal government picks up your coverage if you're under Medicare. But the cost of dialysis for a person to pay for it out of their own pocket is tremendous, so that's almost impossible to do. So you have to be covered in some form of fashion.
You got to have some kind of coverage in order to be served in reference to that. And those individuals who might just so happen not to be covered, they're sort of what?
They get coverage.
There's always something, there's always a stopgap in a real sense.
Yeah, if you're a citizen of the United States, then the United States certainly covers you through the state or federal funds.
So very good. And so there's a recognition on the part of the government that some individuals, even though, and we often hear people talk about people who don't have health coverage and et cetera, but if your health is of such that you really need this in order to survive, that there is always a possibility of somebody coming to your aid.
And we have people in place at Metropolitan Nashville General Hospital as well as the dialysis unit to help facilitate that coverage.
Very good. So and so the medical community is doing almost as much as they can possibly do in terms of trying to curb this disease, but without the assistance of individuals themselves, then there's not that much we can do.
Yes,
is that a correct assessment?
Yes.
But that if an individual believes that he or she might be drifting toward that there are some things that you've indicated that they can do, because if they don't do these things, then the possibilities of them ending up on dialysis and et cetera is very great.
Yes.
So is that,
yes, it is. It's very great.
Very good. And of course, Dr. Faulkner, we've got about a minute and a half before we end this show for today, but do you have any final comments that you'd like to make in reference to some of the things that we've talked about?
Well, you know, I think that we should watch our weight. We should exercise more. We shouldn't supersize. We should watch the fast foods that we eat and try to cut back on them. Eat fresh fruits and vegetables to prevent diabetes. If we have diabetes, then we should certainly monitor our blood sugars very closely. We should visit the doctor regularly. And we should make sure that we get our eyes examined have eye examinations once a year. Make sure we visit a dietitian or get some kind of diabetic counseling at least once a year. So we have things that we should do. We should monitor our cholesterol and our lipid levels once a year. So there are things that we should do, and certainly we should monitor our kidneys every year.
And so if an individual is really concerned about his or her health, and they understand the possible outcomes, if they are not conscientious in terms of trying to deal with some of the problems, then it's really up to them. It's very little that you can do as a physician. The only thing you can do is deliver the message, but if they don't accept the message, then there's very little that anybody can do. That's right. Okay, well, I appreciate, Dr. Faulkner, the information that you've given us. Again, I believe that it is an excellent piece of information. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you and good morning.
News, weather,